because we need to discuss a rather difficult topic. What would happen to you if you could no longer make your own medical decisions, or if you had to start the conversation about planning for the end of life with a loved one? Well, as unpleasant as it may be, it is important to start thinking about these situations. And joining us now to ease us into this subject is Reverend Carl Anderson from Masonicare. It's so nice to meet you and to have you on our show.
Thank you. It's great to be here.
As I mentioned, not the easiest of subjects to kind of talk about, but extremely important, and timing is key here, right? When should we start thinking about these things?
Well, the idea is to think about these things when you're well, when you're able to make decisions, that you can just figure out someone who will speak for you, that can speak from your ethics, from your vantage point, what you want in terms of advanced directives, what you want in terms of your care, if indeed you could not speak for yourself.
Mm-hmm. And you're saying that while you're healthy, while you're young, right?
Right.
Start thinking about these things.
Right. While you're healthy, while you're young, look at things that are going on in the healthcare world. Look at, certainly it's important to have advanced directives so that if you can't speak for yourself, they would speak for you, and then have the healthcare representative who can speak for you as well. Sure. And that's someone that you have to plan for and pick very, very carefully.
Absolutely. What are some of the key things, key factors that we should be looking at when we think about, later on in life or the end of your life?
Well, certainly, if you can't speak for yourself, what are the things that you want and don't want? Do you want CPR? Do you not want CPR? Do you want artificial anything going on? The idea then is to think about, okay, what is it I want? And then to be as specific as possible. And then to have your healthcare representative understand that these are the things I want, and these are the things that I don't want. These are the things that are important to me, and these are the things that are not important to me. And even after I pass, these are the things I want to have happen, and these are the things I do not want to have happen.
And preparation is key, because as uncomfortable as it might be, being prepared and having an idea or some thoughts about these important things that you mentioned really helps to even ease, thinking about these things, right?
It really is a gift for your family to have that all prepared, so that when something happens, and I don't know what mom or dad or a loved one would want, gee, we have to make a decision now, and I really don't know. If it's all laid out in a document, it's a gift. At least then, okay, I have it all down. I know exactly what he or she wants, and therefore I can make decisions accordingly.
It helps during a time that is very difficult in and of itself, right?
The stress of that kind of time, and then you've got all kinds of things going on around you, doctors and nurses coming in, and you're getting different perspectives. So to make that decision is difficult in and of itself, but then not knowing makes it even more difficult. So having that document, and more importantly with that document, and you can do it several different ways, having that document available so people know where it is. Sure.
Let's talk about Masonicare and how you guys come into play here, the services you offer, the help you provide for individuals, either starting this journey, thinking about this time in their life, or perhaps approaching it.
Well, certainly within our continuum of care, we certainly provide our social workers who help people with making these documents, or help them actually executing these documents in terms of advanced directives, and a healthcare representative, but also our hospice care. Our hospice care, we walk with people on that sacred journey many times and are able to help families execute these documents, also provide the care, and also make decisions, and help them make decisions that are in keeping with the person's desires, their wishes.
Wonderful. And you have a few locations, and really you cover the whole state, right?
We do. Our home care covers the whole state, and then we're in Wallingford, we're in Chester, we're in Mystic. And we really do provide an exceptional continuum of care that services a person really from independent to skilled and beyond.
Wonderful. Well, thank you so much. It was great to have you on. Very important information to share.
It was great to be here. Thank you.